we're pretty much ignored by the government. And that's our elected representatives in the government. So it's more important than ever to really engage with the policymakers that represent you. You are constituents. I hope you all vote. And when you vote, you have to kind of figure out, well, which candidate is talking about the issues in the way you want them to talk about it. And do they understand? I mean, every candidate out there for public office says, I'm for kids. Every one of them. You know, there's none that say, no, I'm against kids. No, but you know, what does that mean? And does it mean just your kids? Does it mean, you know, just your grandkids? Or does it mean all of our kids? And how do we help all of our kids have opportunities to thrive, to get ahead, to make a living, to raise their own families, to pay taxes? You know, we've done very well in building a cradle to prison pipeline. We haven't done so well with cradle to career. And that's why our economy, I mean, it's all in our self-interest. It's even the Grosse Pointers, the Bloomfield Hills residents, it's in everyone's self-interest to have an educated workforce contributing to our economy and not drawing resources away from those things. And so MichigansChildren.org has a wealth of information about issues going on right now, policy issues, including issues of race equity and the lack of diversity and the overrepresentation of minorities in these various systems for Department of Human Services and juvenile justice. And we offer opportunities for people to understand when it is important to speak up, to contact your representative, to talk to him or her and explain why. You know, we need this in our system, that we need this option, we need better health care for our infants and toddlers. We need programs for 0 to 5 age group that gets them ready for school that are more than just learning opportunities, but also involve their health care and access to programs that help with the special needs of many of these kids. They don't know that. You know, they're in Lansing, and they're mostly white, they're mostly male, they're mostly middle-aged, my age or older, and they're business people. You know, that's the constituency they're hearing from. That's the constituency they're trying to placate by cutting taxes on business. And the folks that are out here struggling day to day, and a lot of you in nonprofits and elsewhere trying to help these needy families, all the supports you have are being knocked away one by one because we can't afford it. We can afford tax breaks, but we can't afford adequate services for our most vulnerable children. And so, if you need help, you know, figuring out who is your elected representative for the House of Representatives, for the state Senate, we can do that on our website. There's a way to do that. But it's more than just you know, knowing who it is, but building a relationship. If that person is in Southgate this week and is having a town hall meeting, go talk to them. Let them know how important our children are to you and to this community. They have to understand this. Right now they're getting very few messages from people who are at the most dire need. They're hearing all about, you know, the business person is not, you know, being taken care of. So, and it's more than just a one-time thing. You know, you can have a cup of coffee with somebody once, or you can stand up at a town hall meeting and ask her the right question, but follow that up. We are citizens. And as citizens, we get the government we deserve. And if we're not willing to stand up, speak up, contact, argue, debate, press your case, you know, with the elected representatives that you have, we don't, you know, it's not a real democracy.
And so I wanted to add just a piece there. So this is our one of many opportunities. Carolyn has been quiet but fervently working, taking notes, because our conversation today, what we want to do over the next 15 minutes or so, is see if we can get some nuggets from you about what are some specific programmatic recommendations that can emerge? What are some specific things that Michigan's Children, in its role as an advocate, can help perhaps even construct back to us that can be part of our platforms when we go forward? Because everything ultimately has a political implication. So even as we're trying to do the best for families, how can we help inform people? Because the reality is that ER costs more money. Let's go for the business case. Let's just assume that you really don't care that much about me. Let's just talk money. And when we just talk a business case, the reality is that on the behavioral health side and on the physical health side, we're spending way too much money because of lack of coordination. So guess what? If we had better coordination, it would actually pay for itself. Guess what? If we actually had more families going to see their physician who knew them, had a good health information technology, who coordinates, who's culturally competent, it would actually begin to pay for itself. I mean, all these things make sense. So we've got to figure out a way to demonstrate, not only should we be doing it because it's a good thing to do. If this place is America, is going to ever meet that dream and that statement and what's in that Constitution, and every time we're around the world and talking, then it has to be something very real. But we also make a case for it financially. So having said that, Carolyn, are there any things that kind of come to mind? You're at the Wayne County Mental Health Agency. That's a huge system that funds and provides direction to and gains information from over 25 different community mental health agencies. Anything you'd like to share?
Well, I think everything that's relevant to the work that we're trying to do in terms of pediatric integrated healthcare has been brought up in the discussion in some way or another. I think, as Jack mentioned, our governor is really interested in moving our system ahead. And the system is split, as you know, when it comes to physical health and mental health. But for those who are Medicaid providers, the system is even more split based on the severity of the mental health needs of the folks that walk in our door. So that even just caused more confusion to the physical health care providers, our partners in physical health care. And it causes confusion for families, because families just want their needs met. They don't care about the funding and the politics behind it. They just have a child in need and they want their child to be served. So in our pediatric integrated care work group, we're challenged with the notion that we, not just a behavioral health, but a physical health, and our partners in the health plan on the behavioral health side need to figure out how to work closely together to ensure families get their needs met. When in a lot of ways we're, I don't want to go so far as to use the term adversary. That seems really, really strong. I'm trying to think of another word that speaks to it, but we serve different populations of people, and with integrated healthcare, with integrated healthcare, we're being called to really work better together to meet the needs of families. I think there's a lot of really neat things that came up, whether it's educating our healthcare providers at the beginning in their academic programs. How do we do that? How do we get to doctors and nurses and physicians assistants, those in the healthcare field early? I think that having information for parents wherever they find themselves, whether it's in an emergency room, the WIC office, their Well Child visit, wherever we find parents, they need the information that they need then. We can't have, if you walk into this door, you only get this. We really do need well-informed folks with the information that they need at hand. This kind of came up, but this is a really big one. An electronic medical record is really being pushed at the national level, and those of us doing this work, we all probably have some type of medical record. You'll hear the language in the field, EMR, electronic medical record. That's what that means when you hear it. Everybody in here that's doing behavioral health and physical health have some type of medical record. It's funny, I started my day at the doctor, and he was like, "You need your prescriptions?" And he's on his thing, and he talks into his little computer now, and he's, every now and then he stops the button and he starts cussing, "Shit, this is wrong." The learning curve is steep, people. He sent my prescriptions off, and I had to stop him and say, "Where'd you send them?" They're like, "Where?" Like, you know, just like me, just like families, they may switch where they go based on where they live or what's convenient. Is, you know, where do you get your prescriptions? Do you get it at near your doctor's office, near your job, near your house? So I had to stop and figure out where it went. It's very convenient, of course. So those are the kind of things we need to begin to be really mindful of, because parents with children, just like people like me, have multiple doctors, and and children are in school, and we had a demonstration of a child who was in child welfare and foster care, and there's all this information that is so needed to make a good clinical decision, whether it's a mental health clinical decision or it's a physical health clinical decision. So the sharing of information electronically becomes really important, as well it is the coordination of care. How do we coordinate care across disciplines? Not only you mentioned kind of like acronyms and the need to know each other's language. I don't know that we'll ever get to the point of perfection in knowing each other's language. Good luck with that. You know, how many got a list of acronyms at their job just for the people who are new? Then I need to know, for example, Dorinda in Children and Family Service, and Tammy over there in DHS, and then Mary Mueller has hers at the Children's Hospital of Michigan. None of us can be experts in all that, but at least being kind of aware of the differences in languages. And if we don't know, families don't know. Come on, we need to be serious about that. But what does, you know, coordination of care look like in your system? What does it like really I know what your policy says. We all have one because we've been moving towards care coordination for a really long time, but what does it look like on the ground for the people doing your work? We need to be able to operationalize it in everyday terms so that we know that family needs are getting met. You know, when that family member walks into your office and it's a child with a physical health problem or a mental health disorder, what's the first thing you do? Do you actually have a process where you ask some specific questions to gain that information? We talked about that. The professionals and most of the professionals in the skits didn't ask some kind of poignant questions about some things that were very visible. You know, there's things you see, and then there's questions. Rosalba talked about the need to assess the whole family. And sometimes we don't have time to do a full-blown assessment because we're there for what we do. But there can be some real clear questions that we can ask across the board that'll gain some clear information that we need to know that, okay, we need to follow up with the physician, or we need to follow up with the school social worker. We need to follow up with child welfare and DHS. You want more?
Well, I think what we kind of need you guys to tell us what you think would be a good policy.
Sure.
That we could pursue, that we could, you know, advocate for, and help the government understand better in a way that will be cost effective and good for kids and families. Mary?
Well, I was going to say a single-payer health system. However,
You can still say it. You can say it. We can still say it.
That's my dream. But if not that, then at least a multiple-payer health system that looks pretty similar no matter which one you're in. Because I think that one of the things that's hard systematically is, you know, this insurance will do this, and that insurance will do that, and this insurance will do something else. And I think that that is very frustrating and hard for families and children, and as well as for providers. And so I think that would be, you know, on the top of my wish list.
So consistency in terms of, thank you, Thank you. I always flunk this flip chart course. I got that time. Consistency, and we have multiple health plans. I mean, many of you know there's over, I believe, 8 different Medicaid health plans in the state of Michigan.